Hi, my name is Sheridan Tompkins, and I'm presenting Fatal Familial Insomnia. What is fatal familial insomnia? As the name suggests, fatal familial insomnia is fatal. It is a genetically inherited prion disease. Prions are mutated proteins that are unable to fold properly. They are defective and do not function. Prions damage the brain by causing protease-resistant plaques to build up. Other common prion diseases include Alzheimer's and Creutzfeldt-Jakob disease. The onset of FFI is latent, usually around the mid-30s. It is initially and famously characterized by worsening insomnia. As the disease progresses, patients develop dementia-like symptoms including loss of motor control, memory loss, loss of communication skills, disorientation, and death usually occurs in about 7 months to 6 years after symptom onset. FFI is incredibly rare. It only affects 22 families worldwide. The probability of someone being born with it is less than 1 out of 1 million. FFI displays autosomal dominant inheritance. An affected parent has a 50% chance of passing it on to their children. FFI is caused by a point mutation, or a single mutation. The mutation occurs in the PRNP gene. The PRNP gene makes PRP protein. This single mutation changes the PRP protein into the protein that causes FFI. The mutation alters the PRP protein's shape. It is unable to fold properly. It is also unable to be destroyed by regulating enzymes in the brain. The mutated protein causes damaging plaques to build up in the brain as well. And then that's the healthy protein and the diseased altered protein. The PRP protein is believed to maintain the stability of Schwann cells in the brain. Schwann cells are the main component of the myelin sheath, which is important for nerve cell transmission and nutrition. The altered PRP protein and the brain. FFI is always associated with damage to the thalamus. The thalamus plays a role in regulating the sleep, motor, and sensory systems. This damage to the thalamus prevents the body from being able to enter REM and non-REM sleep. FFI is very, very rare. It is believed that the first occurrence of FFI happened in Italy in the mid-18th century. Depending on the severity and the state of the disease progression, the patient could have a very poor quality of life. This could happen due to loss of mobility, loss of motor control, paranoia, and hallucinations from sleep deprivation. Watching a loved one's steady decline can also be difficult on the family. FFI can only be confirmed by a post-mortem examination. FFI is first diagnosed by the symptoms. Because it is so rare, the patient's family history is especially helpful in reaching a diagnosis. A blood test can be done to see if the PRP gene mutation is present. There is no cure and no effective treatment for FFI. Patients typically pursue a palliative treatment such as anxiety pills, mood stabilizers, and antipsychotics to help with paranoia and hallucinations. Curiously, sleeping medications only exacerbate the illness. Sedatives have been known to put patients in comas. Gene therapy is one of the most promising potential cures for FFI. However, more research needs to be done in gene therapy in order for the cure to become a reality. It is important for the public to know about FFI because knowledge is the first step towards prevention and cures, and because it is a prion disease, it shares many characteristics of other debilitating prion diseases. Curing or discovering better treatments for FFI could provide powerful insights to other prion diseases. The end.